Diagnosing Alzheimer's disease is a challenge. Right now, the only way to definitively diagnose Alzheimer's is through an autopsy. Kaya, in a distant future, is it possible that a drop of saliva could determine if we have Alzheimer's or not?
Not only is it possible, Eric, but this future may be closer than we think. The Faculty of Science of the University of Alberta has created a non-invasive diagnostic test targeting metabolites in the saliva. The study shows that metabolites can identify early changes in the nervous system. Hence, they can be used as biomarkers for an early diagnosis of Alzheimer's. A higher metabolite concentration was associated with a decline in cognitive abilities and a slower performance. The saliva test could eventually help us differentiate between normal aging, mild cognitive impairment, and Alzheimer's disease, as presented by Shraddha Sapkota last July at the Alzheimer's Association International Conference in Washington.
Using saliva can advance the cause of early detections of Alzheimer's disease risk in both the mild cognitive impairment and the normal aging group, promote an understanding of the mechanisms that lead from the normal aging to the mild cognitive impairment in the Alzheimer's disease group. It will also enhance participation in remote centers and diverse populations, and also provide us with sensitive and objective biological endpoints for evaluating comparative effects of different risk factors and interventions.
The study is in the early stages, and we don't yet know how the metabolites will compare to other biomarkers such as tau and amyloid. Neurologist Dr. Dean Fati comments on the validity of the saliva test.
The significance of this test is at present unclear. Obviously, it's a great idea to obtain a simple thing such as a saliva sample, which is obtained with a cheek swab. It's very easy to do, very accessible, doesn't even involve going through the skin. However, its validity at this point is unproven as the sample size is so very small. One of the intriguing aspects of the test is that they indicate that some of the metabolites are able to be correlated with memory scores in different patients. So even the ones in the mild cognitive impairment or the normal control group, there seems to be a correlation of some metabolites with their memory scores. And similarly, there's another metabolite that correlates with speed of information processing. That is a very interesting concept, as it could be very useful as a surrogate measure of cognition if it turns out to be reproducible in a much larger sample.
Parorobots may look like stuffed animals, but these furry baby seals are actually medical devices. They're already used as companions by depressed and socially isolated elderly people, as well as Alzheimer's patients throughout the world.